Welcome to Inside 340B Report, an insightful conversation between 340B Report's editorial team on the key issues affecting the 340B drug discount program, the nation's second largest government drug program.
Hello and welcome to the latest episode of Inside 340B Report. I'm Shannon Young, an associate editor and senior writer at 340B Report, and I'm joined today by my colleague Will Newton, who's also a 340B Report associate editor and senior writer. Thanks for joining me, Will.
Thanks. How's it going, Shannon?
It's been a busy time. So before we dive into the latest major development in 340B rebate saga, that is this new guidance we've gotten, I want to let our listeners know that we are pleased to offer a special 25% discount to 340B Report first-time subscribers. You can go to the subscribe tab at 340breport.com and use the coupon code podcast25 to take advantage of the discount. I know you'll find our new service to be a valuable investment. Also, I want to encourage you to check out 340B Report's new business area podcast, hosted by Ted's longtime colleague, Anna Magnum. 340B Report's 340B 360 podcast showcases leaders from our valued sponsor companies and the crucial role they play in 340B ecosystem. And just a note that Ted, our publisher and CEO, is not joining us this week, but we look forward to having him back on the podcast for our next episode. So today we're going to dive in to HRSA's newly released proposed 340B rebate guidance, which would establish a pilot 340B rebate program for a narrow set of drugs with strict requirements for manufacturers. We're also going to discuss key takeaways from the 340B Coalition Conference that just happened in National Harbor, Maryland, outside of DC. And we'll hear from Will about 340B Provider Advocate March that he covered on Capitol Hill. So start off, Will, can you tell us more about HRSA's rebate proposal?
Yeah, so HRSA, the Health Resources and Services Administration, finally released its highly anticipated proposed 340B rebate guidance. And it basically proposed a pilot program that applies to a pretty narrow set of drugs and has a lot of requirements for how that rebate can work. It's definitely a lot more limited than the rebate proposals that manufacturers had been proposing. That said, though, a rebate of any scope is a pretty dramatic shift in how the 340B program has operated for more than 3 decades since its inception, which is to say it's really been an upfront drug discount program. So there's certainly a lot of concern among providers, and we'll get to that more in a bit, about sort of the impact that a rebate of any scope could have on their operations and their finances, and how that in turn affects their ability to serve vulnerable patients. But before we get to that, I'll start by sort of giving an overview of what is actually in that pilot. So the main thing is that it would apply, at least to start out, only to the 10 drugs selected for Medicare drug price negotiations under the Inflation Reduction Act, or IRA. So as many of our listeners know, under the IRA, Medicare is allowed to negotiate drug prices with manufacturers starting with 10 drugs in 2026. And those would be the only drugs that are actually subject to this potential rebate pilot. And the manufacturers that have those drugs selected would then approve, or would then apply to have their rebate program approved by HRSA. So given these potential drugs, the manufacturers that could have rebates would be Bristol Myers Squibb, Johnson & Johnson, Boehringer Ingelheim, Merck, AstraZeneca, Novartis, Amgen, AbbVie, and Novo Nordisk. So those are the ones that could be applying for rebates. And if they do get a rebate accepted, then it would only apply to the specific drugs under the Medicare drug price negotiation program in 2026. So under this guidance and pilot program, manufacturers would have to provide covered entities with rebates within 10 days of receiving claims data submission. Covered entities would then would have 45 days from the date of dispense to actually submit and file the claims data. So it specifies 11 items that HRSA describes as readily available pharmacy data that covered entities could be required to report under this rebate pilot. So, that's a lot less items than what manufacturers were requesting in their initial rebates, certainly than what Sanofi was requesting, because Sanofi had sort of an additional amount of data they were requesting to verify whether or not a patient meets the patient definition. So it's much more narrow in scope than that. That said, it is new data that covered entities will be providing manufacturers. So I'm sure there will be some concerns there. But really, when looking at this, a pretty big, important element, I think, is what it allows manufacturers to, deny or not deny claims. So it very specifically says that manufacturers can't deny claims for alleged drug diversion or Medicaid duplicate discounts. And it says instead, if drug makers have concerns about this, they have to go through the administrative dispute resolution process, or ADR. So they can't deny any claims there. That's something drug makers have wanted to do in their rebates, but under HRSA's pilot, they can't do that. That said, I would expect that manufacturers are going to be gathering and using this data to sort of accumulate evidence for their claims that there's a lot of abuse in the program that they'll in turn use to try and pursue their agenda and legislative request elsewhere. So even though they can't deny claims on this basis, I'm sure that will have some implications for the broader fight about the 340B program. It does, though, allow manufacturers to deny claims related to compliance with the IRA. So, as probably a lot of our listeners know, under the IRA, it requires manufacturers to give covered entities the lower of the 340B ceiling price or the negotiated maximum fair price, or MFP, but it specifically says they can't give both. There's been a lot of concern from providers and manufacturers about how they'd figure this out. And the pilot program does specifically note that, if drug makers have documentation, they could deny a claim for the 340B discount if that drug was already subject to an MFP. So the IRA doesn't take effect until 2026. So we don't really have a sense of how prevalent these MFP and 340B duplicate discounts could be and how big of an impact that'll have that manufacturers can deny those claims. Certainly, though, the fact that it's in manufacturers' control to do that, I'm sure poses some concerns for covered entities. And final sort of things are that it requires manufacturers to pay for everything and have data security concern or assurances and customer service assurances. I would imagine that because this is moving so quickly, the two technology vendors that we've seen working with the drug industry so far, Calderos and Beacon Channel Management, which is related to 340B ESP, I would imagine those are the only two vendors that are going to be in a place to do this. They've already worked with manufacturers in the past to try and implement their much broader rebates. So I would expect them to be players, but that certainly remains to be seen. And as far as the actual timeline, it's proposed guidance. So stakeholders have 30 days to comment on it, but manufacturer applications to implement a rebate are due September 15th. HRSA said it will make decisions about whether or not it's approved these manufacturer applications by October 15th. And they will then take effect at the very beginning of 2026. So certainly a ton of moving pieces here that we're going to be closely following. And so related to that, Shannon, I know you've done some reporting on how different stakeholder groups are reacting to this, pretty bombshell news in the 340B space. Can you talk a little bit first about how providers have been responding?
Yeah, so just want to preface it by saying this is all very new. It's come out within recording this podcast within the last 24 hours. So stakeholders are still largely reviewing what's in there, going over the fine details. But in sort of initial responses that we've seen, they're not too surprising. Providers, especially hospital groups, have raised a lot of concerns about implementing rebates of any kind, including the ones proposed in this pilot model. They've argued it's a, quote, significant departure from the upfront discount model that the program's operated under for more than 30 years. They've also argued that it would add additional costs and burdens to hospitals. 340B Health, which represents over 1,000 340B hospitals that participate in the program, they've argued that it could cost hospitals millions in terms of having to float money while they wait for rebates to come back. And that's based on a survey of their members, which is looking more at a larger number of drugs that would be subject to these rebates. So, the actual numbers there is kind of unclear, but it still would have a large financial impact there. The American Hospital Association called it a non-existent program integrity problem that drug manufacturers have created in the public discourse. And America's Essential Hospitals argued it's going to require more bureaucracy, more paperwork, and it's going to make the program more expensive to administer. And privately, 340B providers have raised even larger concerns about this and how it's going to be implemented. So it's not too surprising. Providers here have been pushing back against this idea for a long time. 340B Health is an intervener in some of the litigation to oppose rebates. And so not too surprising, and it'll be interesting to see what else they have to say as they dig more into the details here, and we find out what happens in the public comment period. But yeah.
Yeah, definitely. It sounds like there are a ton of major concerns from the covered entity community from what we've seen already, and we're expecting more concerns to come out later. So the other big group involved in this is the drug industry. I know, Shannon, you've reached out to some parties there. Sort of how are they responding to this initial news?
Yeah, so also, not that surprisingly, the drug industry is also not too keen on this guidance. They've argued it doesn't go far enough, that their models would have done better at addressing transparency issues that they say are in the program and abuse that's in the program. Pharma, which is the drug industry trade group, called it a positive first step toward addressing hospital abuse of the 340B program, but argued it should cover all medicines and address broader program integrity concerns. Sanofi, which is one of the drug makers that's proposed a rebate model, said it was pleased to see HRSA recognizes the need for fairness and transparency within the 340B program, but believes the proposed pilot program lacks the substantial and swift reforms that are needed now. And then J&J, which was the first drug maker to set off this whole rebate saga about a year ago, was a little bit more muted in its response. It said they commend HRSA's initial efforts to bring much needed transparency to the 340B program through this rebate model, and that they look forward to working with HRSA on it. So that was, pretty interesting. Other drug makers that we reached out to who were part of this litigation said they're still reviewing it and going through its implications. And Calderos, which is an industry vendor, as Will mentioned, they also were pretty middle of the road on this. They lauded HRSA for putting out this guidance as sort of a first step, but didn't really weigh too heavy into one side or the other, which again isn't too surprising for them. So it will be curious to see what type of comments, again, drug makers submit on this front as we go through the public comment period.
Yeah, and I think as has been the case with a lot of things HRSA has done over the course of the 340B program's history, pretty much everyone's been upset at them. And in this case, as you mentioned, it seems like the drug industry is a little less upset than providers, given that HRSA is allowing some form of rebate. And I think when we're sort of looking at this, it's important to sort of step back a little bit and think about how it is that we got to this and this pretty important shift. And it really dates back to, about a year ago when several manufacturers, including Johnson & Johnson, first went to HRSA and proposed pretty expansive rebate models. HRSA said, no, you can't implement these without our authority based on the 340B statute, and then they filed lawsuits. And during a hearing for one of those lawsuits, a federal district judge kind of pressured HRSA and said, you need to do something or release something about rebates and specifically compliance with the IRA. And that's sort of what prompted HRSA to go ahead and say, okay, we're working on draft guidance and ultimately release this guidance. So after that, that same federal judge, as well as another federal district judge, both in Washington, D.C., upheld HRSA's authority to decide whether or not manufacturers can implement rebates. And HRSA is citing that authority in the statute that those courts have upheld in order to actually issue this guidance. But, it is proposed guidance. A lot could still change. I think a really important piece of this is that most of the drug makers involved in those earlier cases have appealed that to a federal appeals court in Washington, D.C. We're expecting oral arguments in September for that, just around the corner, right around when these rebate proposals are due. 340B Health, as Shannon mentioned, is also intervening in that litigation and specifically is arguing that the 340B statute categorically prohibits rebates of any kind. So, depending on the results of that federal appeals court case, HRSA's entire authority to do this could be completely upended. So there's certainly a lot of uncertainty there. And I think finally, it's really important to note just how much of a role the IRA played in all of this. And it really does seem like out of all of the arguments drug makers had been making in favor of rebates, compliance with the IRA is what ultimately stuck the most, both with judges and HRSA. The federal judge that pressured HRSA to do that originally was citing IRA compliance. HRSA was also citing IRA compliance in this guidance, and IRA compliance is really the main case where HRSA is even allowing manufacturers to deny claims under this rebate model. So I think this pretty huge new program that intersects a lot with the 340B program and still carries a ton of uncertainty is a pretty big piece in all of this as well.
Yeah, well, I think those are all really important points. And it seems crazy to think that this is all unfolded just in the last year. It seems like just yesterday when, J&J released their bombshell news, they were going to do a rebate model. So it's definitely going to be interesting to see what lays ahead in the next year for this. But before we continue, let's take a moment to hear from one of our great sponsors.
Pillar Health sets the standard in 340B with innovative solutions that empower organizations and drive operational success. With a foundation of integrity, exceptional service, and relentless innovation, Pillar Health takes the complexity out of managing your 340B program. Focus on what matters most, serving your community, and let Pillar Health handle the rest. Find out more at pillarhealth.com.
Yeah, so before HRSA released this super important guidance that has been completely consuming the 340B world, a lot of stakeholders from across the 340B community, largely from the provider side, gathered just outside Washington, D.C. in National Harbor for the annual 340B Coalition Summer Conference. Shannon, I know you attended and covered the keynotes. What are some of your biggest takeaways there?
Yeah, so it was great to be on the ground in Maryland and meet with a lot of different 340B stakeholders, hear from some of our listeners, and meet with you all. It was really interesting. It was a little bit more action packed, I think, than the winter conference, just because of the rebate things that have been heating up in litigation and sort of federal developments we've had with Big Beautiful Bill since then. And so that took up like a lot of the conversation. 340B Health President CEO Maureen Testoni gave some of the keynote remarks, and she previewed the release of the 340B Patients Act, which was a bill that was introduced in the last Congress that was reintroduced last week. And it would essentially return the 340B program to where it was pre-2020 when drug makers started putting restrictions on contract pharmacy use. So Peter Welch, a senator from Vermont, and Doris Matsui, a congresswoman from California, reintroduced that bill. Just noteworthy that the bill in the last Congress didn't see a lot of action. They didn't have any Republican support, and that kind of doomed its chances of moving in a GOP-controlled Congress. That also appears to be the case at the moment. They don't have a GOP co-sponsor yet, but hope springs eternal that they will find one from what we've heard. And then aside from that, Testoni also talked about the drug industry's recent criticisms of the 340B program's growth and alleged lack of transparency on how hospitals spend 340B savings. She argues there's so much research that counters those assertions, and she urged stakeholders to, really push back against that narrative. Also noteworthy was Vashiria Keys, the Vice President of Policy and Regulatory Affairs at the National Association of Community Health Centers, was back at the conference and appeared on stage before Testoni's remarks. And it's noteworthy because even though NAC is part of the 340B coalition, it hadn't formally attended the coalition conference for a few years due to tension over the group's alliance with the drug industry to pursue 340B legislation that hospitals and other providers strongly oppose. And that is the Access Act that was introduced last Congress. So it's unclear whether there's sort of a kumbaya moment there, but it does seem like there is more of a mended fence there. There's also no protests at this conference as there had been in the past. And then we also had an update from the Office of Pharmacy Affairs Director Chantel Britton, who stressed her agency's, quote, steadfast commitment to ensuring the 340B program operates with accountability and transparency. She did not comment on President Donald Trump's recently unveiled plan to shift OPA to 340B or shift OPA's 340B oversight to CMS. She also didn't comment too much on 340B rebates. She stressed that the important role that the 340B program plays in supporting safety net providers, and she noted that HRSA had been working on guidance, but that was about it there on the rebate front. So, some updates, but nothing earth-shaking.
Yeah, and I know that, in addition to all of the interesting chatter and those keynotes there was also a congressional update with a couple of healthcare policy experts that you covered. Had sort of some interesting takeaways about where we're heading in Congress. Can you tell us a little bit more about that?
Yeah, so Tom O'Donnell, who is the Senior Vice President of Government Relations for 340B Health, and Mike McCann, who's a provision policy founding member and the former Pink Sheet editor-in-chief, discussed federal updates in the 340B world. They noted that, the big, beautiful bill, the reconciliation budget, which included giant Medicaid cuts and some other healthcare policy implications there, really took up a lot of the air in the room in Washington over the past, half year. And it's probably going to continue doing that for the rest of 2025, just given all of sort of the implications and fallout there for healthcare and hospitals and Medicaid. Though they did say that there's a couple areas we could see gaining some steam. And one is PBM reform. And also 340B reform could see some action, primarily because pharma isn't letting either of those topics drop. So PBM reform is pretty bipartisan backed. The president has said he supports it. Members on both sides of the political aisle in Congress have said they support it. There's been legislation introduced on it. But it's one of those issues that even though everyone says they support it, it can't quite cross the finish line. It's been pulled from multiple bigger bills, year-end spending bills, the big beautiful bill, and it's kind of unclear why. We haven't ever really gotten a great answer aside from the fact that PBMs just have like a very powerful lobbying presence. So that's an issue that there is bipartisan buy-in, but it's unclear whether it will actually move again this time. And then 340B reform could see some action, but there is the issue there of trying to explain to the general public what exactly 340B is, what it does, what it doesn't do, and why it needs to be reformed. And that is a big lift, I believe. And so, our lawmakers really going to vote a ton of time, focus on that with everything else going on. It's unclear, though pharma notably has been running ads in the Washington, D.C. area, I think during the British Open golf tournament, that was focused on 340B. And that's really interesting. And it just suggests that, pharma's not letting this issue drop anytime soon. So who knows what could pop up there. But the general consensus is that Congress doesn't have a lot of appetite to make additional healthcare changes, just given everything that happened in the reconciliation bill. We also didn't really get a major update on the SUSTAIN Act drafting efforts there. From everything we've been able to tell, it's kind of just chugging along in the background, but no major progress has been made quite yet. So we will see if we finally get a draft of that in the fall or in the meantime. And then the 340B Access Act, as I mentioned earlier, that's the more controversial reform bill that's being pushed by pharma and NAC, and would make a ton of major controversial changes to 340B. We haven't heard a ton of movement or any real updates on that bill. So it's unclear whether that will be introduced again this year.
Yeah, and so it sounds like that was a super interesting conference. I was not covering the keynotes and the conference itself, but right after the conference ended, I did get a chance to report on the 4th annual Defend 340B March. That was unaffiliated with the actual conference, but a lot of provider advocates who are at the conference did attend that march, and it was pretty cool to get to sort of experience that and talk to a lot of people on the ground. So it's the 4th time they've done this. It was a record turnout. It's also the 3rd time that I've covered it. So it's been cool to sort of see how it's evolved over time. So this was organized by Community Voices for 340B, which is a nonprofit advocacy group that's entirely separate from 340B Health. So they sort of had this area where all of the marchers could get their Defend 340B signs and write messages about what the program meant to them. They were doing a lot of chanting as they marched towards Capitol Hill, including slogans like "Down with Pharma Greed, 340B is what we need." And it was definitely interesting, as Shannon and I, as journalists at 340B Report, we're spending a lot of time, covering CMS regulations or the rebate saga or lawsuits, but it's always cool to get the chance to just sort of talk to different people that are just out at the march and sort of see how this large drug discount program affects people on a more personal scale and what it means to specific people. So I always really enjoy getting the chance to do that. And it was cool again to see the record turnout there. So this march towards Capitol Hill happened also at the same time as some other 340B related activity on Capitol Hill. So 340B Health held their member lobby days right after the conference, where a lot of their members were lobbying different House and Senate members about 340B and sort of what it means to them and their policy priorities there. Another different group, the National Association of Healthcare Purchaser Coalitions, also had a lobby day that day. That group's been pretty critical of the 340B program, and it did list 340B reform among its policy priorities for that lobby day. So certainly a ton of activity was happening on Capitol Hill right after the conference and leading right up to this giant rebate news that we just got.
Yeah, and Will, thanks for covering that march. I know it was a very hot, humid week in Washington, D.C. area, so thanks for taking one for the team there.
Yeah, of course. Weirdly enough, it was still very hot and humid, but it was so much better than last year when we were like actually in the middle of a heat wave, and it was pretty rough there. So I mean, mid 80s for summer DC standards was pretty good for the march organizers, I'm sure.
Oh yeah, one thing you can say about these 340B advocates is that they're definitely dedicated if they're going out in the summer in DC to march. So
absolutely.
That brings us to the end of today's episode. We'll continue to keep an eye on all things 340B related and be back in 2 weeks with a new episode. Of course, we'll report on anything that happens in the meantime on our website, and I imagine that we will be very busy thanks to the rebate model. Please follow along with our twice weekly newsletters, which come out each Tuesday and Thursday. And as a reminder, if you're not a current subscriber, you can take advantage of our 25% discount by going to 340breport.com, clicking the subscribe button, and using the discount code podcast25. Thanks again for joining us.